Hello, this will be my next YouTube video, and this one I'm just winging it. In other words, I'm not reading what I wrote, so if I make a mistake, I apologize. But I didn't really think about how I was going to say anything, or what I'm thinking, but I'll see if it comes to me as I go. And I thought we'd talk about healthcare, since that's a hot topic. And the way I see it, quite potentially everybody's going to need health care through their life or at some point in their life if they live long enough. And but at the same time, some people will go through life never seeing a doctor and having no health issues, and all of a suddenly die. And so health care and health insurance wouldn't have benefited them whatsoever, and nor would having to pay into a system benefited them. So, seeing as that's the case, that some people might be healthy their whole way through, they might die at 10 years old or 50 with no health problems and never had any. And so since there are some people that don't need health care, then it's not for sure a public thing where the whole public needs it. So I don't think government can pay for these things for the benefit of the public, since it's not necessarily a public work. But we can arrange it where it would work, quite potentially, even though it's a complicated matter. Starting with the facts, doctors price out their care at a higher level than what they expect to receive, so they're bumping it up, just trying to get what the best is they can get from insurance as well as the patient, because insurance is dragging them down to a level that they see fit, trying to do the doctor's business, and that's not good. And plus, maybe insurance dictates who you can see and who you can't see and what have you, so that makes it complicated more. But the unfair things that I could see with private health insurance, and as for at least those that have it, is that when you get sick, the health insurance conveniently drops you, which is completely unfair unless that insurance company went bankrupt and had to drop their whole pool. And say they did it that way, which is more fair, dropping the whole pool because they went bankrupt because there's more claims than they were receiving in premiums. If they went bankrupt, everybody would have to go to a different company, and some of those would already have existing conditions, or call them pre-existing conditions, and yet they'd still need health insurance. They'd still need to be in the pool. They'd still need to at least get some of these ridiculously priced health care costs paid for. And some of the reasons why health care is so expensive is because doctors charge too much, or feel like they need to make maybe too big an income. But I might be wrong, but I'm just guessing that might be part of it. But healthcare in general, I would concede, has expensive equipment to pay for and facilities, and that kind of expense does get pricey. So, and with the staff and all qualified people, even the doctor with his education and dedication, they deserve good money, don't get me wrong. And we should appreciate the doctor, the Lord said, because he does the Lord's work. at least part of it. So yeah, the staff and the doctor need a good income, and they need to cover their expenses, and then they need a going concern, and all in all, that makes for healthcare being fairly expensive, even at a reasonable big income, and but not outrageous like it might be now. Let's say it was just a reasonable good income, which they deserve, a good income for their staff, and paying for the facility and the equipment and being up and running all day long, it would be pretty expensive for healthcare. So, seeing as it is an expensive thing in life and everybody might need it and some might need long care, well, and that could get expensive, then we need to have health insurance. And you would think the greater the pool, or the greater the amount of people that pitch in and to cover those in the pool that get sick, the less money you'd have to pay in to have enough to pay out to take care of those that are sick. But we need to get everybody in the pool, get everybody insured, because everybody potentially might need health care in their life, and so they need to be contributing pretty much all their work life to the pool to cover for the sick. And we can arrange how we finance this, but for now, everybody being in the pool, which they're not now, but somehow we could see if we can work it out, would cover the least amount contributed to the taking care of those that are sick. We would want to take the approach as a public, say the citizens of the United States, trying to come up with health care that would work. We'd all want to be in the pool, but yet we want to take the Lord's advice, Jesus Christ, when he says that those that are whole need not a physician, but those that are sick. So in other words, if you're not sick, again, if you're not sick, you don't need a doctor. So don't think you need to go and get daily checkups or weekly checkups or monthly checkups. I mean, at least the doctor would know you to know a little bit about you, that you were once healthy, and they see your healthy body, and then they see it unhealthy. But maybe they can figure out it's unhealthy without seeing you healthy. But we want to go by the Lord's advice, that maybe he was talking about himself, but because he is the greatest physician, the greatest healer. But you know, the Lord does, I mean, the doctors do the Lord's work and healing people and caring for the sick and caring for the elderly and the geriatrics and even the young pediatrics, and they do all kinds of work. I agree, it's good. There's a few practices that doctors do that I wouldn't allow to be done to my pet skunk, even though I don't have a pet skunk. In other words, I don't agree with all their practices and all the things that they do. But that's beside the point. I don't believe all of them, and I don't trust all of them. I trust the good ones and the honest ones and the ones that care and that are trying to do a good job and would never do a practice that didn't need to be done just for the money, or guinea pigging somebody, or doing a practice that when it makes sense to an ape. And some of these practices, no, I'd rather stay away from a doctor. But doctors do good work. They do the Lord's work. If you're cut, they'll stitch you up, and if you're broke, they might be able to repair you. And if you're sick, they might be able to heal you. And there are good medicines that they've come up with that do help, and some maybe that are not as good. But it's not all about the money. It's really about the trying to provide the best health care. And we could take an approach in America to eat better and live a healthy lifestyle and exercise and be presenting that, and that would be the best to keep people from the pool from being sick, making your premiums of everybody in the pool cheaper and less money. And also, it's less money for you when we tell everybody if they're not sick, do not, I repeat, do not see a doctor. In other words, don't go for regular checkups, or how is your gynecology doing, or how are you aging, how is your physical. But maybe if you're feeling sick, you need to get a physical, and you need to see what you need to do differently. Maybe if they can see a sickness before it arrives, they can tell you what to do differently to avoid the sickness that maybe is coming on. But I guess the only prevention of sickness is healthy living, or eating right, or exercising. But maybe the only reason for checkups, and I concede that there may be reasons for some, is early detection of things that they can repair in the early stage, but yet not in the late stage. Maybe like breast exams or mammologies, or whatever they're called. So I'll concede a little. But anyway, so if we have a pool of everybody in it, you can only contribute to an insurance pool when you can work and make money and contribute to it. So the kids won't be contributing to it. So they would have to be on some kind of family plan. And but I think the best way to do it is to have it private, with private insurance companies, and I guess dividing the pools up into 100 pools compared to one. If everybody's in it and it's substantial enough, it'll cover those that are sick compared to those that aren't within that particular pool. And like I say, if they can't drop you, the government can say, we don't allow insurance companies to drop somebody once they get sick. It's against the law. And if they go bankrupt, well, the insurance company couldn't pay their claims, so they go bankrupt, and then that whole pool needs to get insurance with somebody else. So you can't have pre-existing conditions either in health insurance companies. You just gotta take on everybody and try to get as many healthy people as you can in your pool. Regardless, your risk manager or your risk managers would have to come up with what the premium would be for your particular pool. And yes, if you have a lot of high risk coming into your pool, your insurance company, well, you wouldn't like that, because it tends to think you're going to go bankrupt or you're going to go out of business because your premiums are going to be too high to cover your sick people and your particular company's pool. So you can charge what premium your risk manager says we got to charge to get a going concern, our incomes and our expenses, and to be able to pay out the claims for the sick people with the pool of premiums we're receiving. We got a lot of high risk ones. We got long care people in ours. We have sick people, and yeah, insurance companies could go bankrupt, or they could have premiums that are too high where they're not receiving new business and new people coming into their particular pool because their premiums are high because they have to pay for the particular sick people. and some people are dumping those insurance companies for other insurance companies because of uh, the premiums, because the company had to pay for a lot of sick people in their pool. It'd be greater if we had one insurance company, and if the government was fair, or wanted to make it a public work, well, they could, if they were fair to the doctor and fair to the patient and fair to the claims and fair about the premium and their incomes and their going concern and their expenses. And because one pool, everybody would be in it, and yeah, the premiums would raise if more people were getting sick, like the baby boomers make it go up or something. Then you had to pay a higher premium. But at least it's the exact premium that it takes for everybody, like 300 million people paying into it, to pay for the, let's say, 20 million that are sick and the 30 million that are getting old age care or nursing homes or what have you. And but we can talk about old age as a different concern. But if it's the public doing it, the government doing it, just fine with me if you're fair. And that way you could mandate that everybody has it and it works, and no business would pay for it, but they would pay a higher amount to their employees and raise the prices to cover these expenses of their incomes to their employees, so that they could pay, in addition to all their other stuff, health care, and they could pay the premium to the government for their health insurance, which would cover them, and it would be exactly what it takes to cover the sick people, and hopefully you're not one of them. But when you are, it'll pay for you. Somebody else will be paying that's healthy for you while you're being sick, and it should be a good portion of the bill of the doctor. I mean, the insurance company should be paying out in insurance what a doctor normally would charge. And if some doctor is a little more greedy or better or wants more, then yeah, the patient should pay to have that premium service given to them. But I guess insurance companies could work it out. But if it was my way, I'd have it all paid for, and the premium a little higher, so that when you're sick, it's taken care of, or when you get old, you're taken care of. But say it's private health care, then it's a bunch of different pools, and if company goes bankrupt, everybody in that pool would have to go to another company, and they would have to accept them. And if they were to pay the premium that they were charging at that time, and yeah, they would get a lot of pre-existing conditions, long-term care people, and they'd get a lot of healthy people too. Just like with newcomers into any pool of young people, like 16, just starting to work, would come into the pool. I mean, it should be the same premium for everybody to make it kind of fair, and that premium should be based on what the risk manager is saying it takes to cover the sick people in our pool. And the more people you get in your pool, the more percentage of sick people you're going to have. But you can figure out sick to healthy, to how many are contributing to what's being paid out, to your incomes, your expenses, and your going concern. And your going concern in an insurance company needs to be a little hefty, not a profit, but a going concern. And that way you can stay in business and keep bringing people on and keep providing the services you're providing, and keep helping people, and keep your incomes and your job. So we could keep it private. If we keep it private, Well, from 16 years old, working, or whenever you start working, uh, somehow the government could make it where everybody needs to. In America, you can't make them buy health care. So if they don't have health care, the doctor has a choice that he doesn't have to care for them, is the bottom line. So, and they won't receive long-term care. They can't go into a nursing home or what have you. But take it to private health care. It's your choice to get it or not, and your choice as a doctor if you want to care for somebody. Maybe in compassion, if somebody's bleeding to death, you would help them, and kind of somehow you'd have to try to encourage people to get into the pools. I don't know how you would do that unless you took it to public works and had a government that was fair, taking over healthcare and making everybody contribute to it, like a Social Security or Medicare, and just being fair to the doctor, fair to the patient, fair about the pool, no pre-existing conditions, no dropping you when you get sick, long-care term health, if you get chronic illness, they take care of you, and everything's paid for, no deductibles, no nothing. All you got to do is pay the premium, and that could be done in the form of a single pay or part of taxes or whatever. And if you got technical, if we didn't have taxes, I'm probably the only one that thinks that's a good idea. The government could always give everybody health care, work with the doctors that would be private, charging their what they charge, and the government paying them what is maybe a medium for all the doctors, what they charge, something that's fair. Um, yeah, if we had a government with no taxes, they could just pay for everybody's health care, and that way business and corporations and incomes and doesn't have to account for that in their sale price or anything like that, or their incomes, but that it would be paid for through printed money. Since everybody almost needs health care, it's almost a public works, just like retirement could be paid for. But retirement, hold that thought. Say we don't change it to no tax system, which would have been better, and you keep taxing people and charging Social Security and all these things. Well, the only way we could afford it is to, as businesses, is to charge the right amount for a product and service, and to get enough money for the incomes to pay at least that share that goes into a retirement fund, healthcare fund, and that is your particular contribution to the fund itself to cover your healthcare when you get sick, or your retirement if you live till you get old and can't work anymore. We could all contribute, and it makes it very complicated, and businesses would have to charge this, that, or the other. They'd have to figure it out. They'd work hard, a lot of paperwork, a lot of offices, and maybe too many office buildings like we have now with lazy jobs. But anyways, why contribute to it? Why complicate it? Why make people have to contribute when it's a public thing and everybody benefits, so everybody pays? But why not nobody pay, but just come up with the money from one source, call it unlimited, and nobody contributes to it, so their structure is easier. The business has to do income, expenses, and a going concern, and the person receiving income from, let's say, a business or corporation, he has an income, and then he has his expenses, and his going concern is saving a little bit here, saving a little bit there, because the public printed money that you would have contributed to before, but now you don't have to, so your life is simple. Well, they're going to take care of your retirement and all the public works, and they're going to provide for public safety and make sure you're not a criminal. And they're going to print the money for your retirement once you hit 70 or 75 or whenever we think you shouldn't be working anymore, you're too old. Or for your health care, they'll just print that from the unlimited money. They'll send what's fair to the doctor. They'll have a code of what's fair, but when the doctor says, it had these expenses though, and it had this, and I had to do that, then they'd have to say, I understand, it did cost you that, it cost you more, and they pay out a little more. Regardless, it pays for the sick people, and it's from an unlimited source. They're just trying to be fair to the doctors, and trust me, government and politicians and doctors go hand in hand. The upper elite, they're definitely going to look out for each other. They're going to take care of each other. They're going to provide the incomes that are great because they are respectable. And in all essence, that's true. But sometimes they get a little hypey, like, how great I am, how great I am. Well, as long as they're not arrogant and they're just doing a good job, they are respectable and they do save lives. So we got to respect them. The upper class or the elite or the first class citizen. Wow. But anyways, I guess if you're in a crash or something and you need to go into an emergency room and they heal you, they are great too. But if they were to do some practice that didn't need to be done, and they were just using you as a guinea pig, no thanks. But anyways, so I vote that we have no taxes, and that public works is paid for, and that anything that's truly public, that everybody would normally contribute a share to pay for because they want it done, but they wouldn't pay for it individually because it benefits everybody and them just in a 1/300 millionth of a way. Well, that would be just paid for as if you paid for it. Since it benefits all, it's as if everybody paid for it. But why complicate the system and strain it and goose and noose it, and instead of just saying, hey, we're the leaders, public works are paid for, y'all figure out what your incomes need to be under a stabilizing system, and your expenses and your going concern, and as it fluctuates till it gets to a happy medium, then we'll adjust our incomes to that kind of medium. And yeah, the upper class and the owners and the business owners and the CEOs and the politicians and the doctors will make extra money for their nice houses and their nice trips and their yachts and their sailboats and their wine and their banquets and their Lexuses and Mercedes Benz. And some of us that do the hard labor, physical labor, work, 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 will maybe drive around in a beetle bug and have an apartment and maybe one couch is a little old and at least food on our table. But if they get it as business and as yourself and as everybody to a good income, then it's a little abundant. You don't want to work too hard. When everybody's working, it'll be easy. We just need to get everybody working. Too many people trying to live other people's jobs or lives and forgot to do their own and forgot to do their part because they're piggybacking or they're living somebody else's life or they're, within essence or agreement, an employer kind of managing on employees is different, but the crossing over and everybody's spying on each other. Well, people are even trying to merit out business, and advertising is out the window because who needs to advertise when everybody's almost told what to do, when to do it, how to do it, who to do it with, what to do next. Too much living other people's lives. You just need to live your own, do your own work. Public works do public works, and private works do private works, and everybody wants the environment and the economy stabilizes after no taxes all of a sudden, and healthcare paid for by the unlimited legal tender of the government, and also retirement's paid for. You don't have to worry about retirement. You don't have to worry about health care. Now what you got to worry about in business is sales and manufacturing and mining and retail and services and doing a good job and working with your company and pleasing the boss and pleasing the employer, pleasing the CEO through rumors, and also pleasing your company and pleasing yourself a little bit within reason. Take that from me. But anyways, what you want to do is all give each other an abundant income to pay for. What do they have to pay for now? No health care. They don't have to worry about retirement or saving for it because it's paid out at 75% of your highest income that you sustain for, well, let's see, how would we do that? Maybe 75% of your medium income throughout your life or something like that. That would suffice. Or maybe 100% since it is paid for. I don't care. But anyways, because that income would have been to pay for what you need to pay for besides health care and retirement. You need to pay for transportation, housing, food, gas, clothing, and all the little things that you need in life, a little bit towards that, so that everybody can contribute to business doing well. And as long as we don't run out of resources, we need to work on replenishing that. That might be a public work that's paid for or what have you, but it might be a regulation of private sector to replenish those trees you're digging up or tearing down. The government might have to step in and say you can't tear up these rainforests. We're all of a sudden not having rain over there, and rain's being messed up over there, and there's torrential rain flow over there, and maybe there'd be regulation from government saying we can't burn fossil fuels and cars anymore. We can burn seawater. It would be better for the air and environment and the ice cap mountains and the coastal cities, that they don't sink. And maybe we can all work together to whatever needs to be done. But if all you're paying is for your expenses, healthcare is taken care of. All the public works are taken care of. It just makes it simple. Uh, Businesses don't have to pay taxes, nor do individuals, nor do you have to pay taxes on your house, nor ad valorem tax on your car, nor do you have to pay a sales tax, nor do you have to pay a cigarette tax or an alcohol tax. And no one's required to get social workers' compensation for their employees. And one thing we can do in the private sector is not double up the insurance. So if we all have house insurance and car insurance, that we don't need business insurance, I don't think. If you're just working on houses, if the house goes up in smoke, it went up in smoke and they got house insurance. Why should we have to get general liability insurance to cover your house when it's covered or should be covered? Maybe they should just charge a little extra to cover it, whatever it was. Ask the risk manager. But I'd say all insurance would be private. I'd say the government printing their own money and printing the money for the sake of the whole public and public works would not be able to do anything but public works. And nobody else in the private sector can print money, by the way, or the FBI will be on your doorstep. And so nobody can counterfeit it. We do need to make sure we have the money flowing in the system, and there'd still be problems, and the public works would be democratic and properly elected, and they might be socialistic in the sense that if somebody is having a hard time with something or another, they get left out or something, they'll have to work on them. But anyways, yeah, I think that'll work. Just everything paid for publicly into an unlimited bank account. As long as you're paying your incomes fair to whatever our incomes would be, that would be fair and abundant to life, to the lowest worker, and a little bit higher for the elite, how great you are, so they can have their Lexus or Mercedes, while we can at least have maybe well, y'all can have your Rolls Royce and we'll have our Lexus. How about that?